I'm Dr. Tree Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be talking a lot about social determinants of health, but in a different type of framework, in a different type of context. The categories are not the same as they are in social determinants of health, but at least this is one way we can categorize everything. So let's get started here. So you have on the left data by zip code, and then you can explore to the right, and this is all in county health rankings. What I really wanted to go over is the health outcomes, health factors, and then policies and programs. It's 3 categories, and then health outcomes branch into 2 other: length of life and quality of life. Under length of life, there's about 5 objectives, and around quality of life, there's about 8 objectives, and that includes low birth weight, frequent mental distress, diabetes prevalence, HIV prevalence, poor mental health days, poor physical health days, and poor or fair health. So that alone is quality of life. And then length of life: premature death, COVID-19 age-adjusted mortality, life expectancy, premature age-adjusted mortality, child and infant mortality. So these are the multiple. If it's length of life, quality of life. Then you can go into health behaviors, which is part of health factors, and then take a look at these. Adult smoking. There's data available for adult obesity, food environment index, physical inactivity, access to exercise opportunities, food insecurity, limited access to healthy foods. Then you have alcohol and drug use, and you kind of see, if you click on one of them, like alcohol and drug use, it will give you a little bit more to explore. So if you wanted to, you can actually view all the measures, and then take a look at some of the health outcomes, what sort of data set it's using. So it's, instead of just BRFSS, there's NCHS natality files, and then you have National Center for Health Statistics mortality files. So there's health factors that are important, and then there's a lot of good subheadings under the category of health behaviors. And then you have clinical care, access to care, uninsured, primary care physicians, and then quality of care. And then socioeconomic factors, physical environment, and then additional measures. So for those of you that are listening, if you listen to the narration, you'll see some of the health factors, and then 30% health behaviors, 20% clinical care, 40% social and economic factors, and then physical environment is 10%. So then that leads to clinical care, which is access to care and quality of care, and then social and economic factors: education, employment, income, family and social support, and then community safety, and then physical environment, and that's air and water quality, housing, and transit. So trying to take these measures and trying to determine what is most crucial and relevant. These are the 4 categories that county health rankings uses. However, the social determinants of health that have been outlined by various authors in terms of the domains, it's quite different. So I'll show you the comparison here. And so now I'm going to be talking about the social determinants of health and how they work together. And this is a moving gift that's on that is on actually Wikipedia. That's where I put this in. And so if you look at some of the domains here, education access and quality, and there actually is data on that. And then if you have healthcare and quality, that's also there. Social and community context, neighborhood and built environment, and the education access and quality. And if you go back to the social determinants of health, some of these actually change. So I'm taking a look at the right. Yeah, this was created by KFF. KFF is who makes this. And economic stability, there's some here. Let me draw. So economic stability. Let me select. So over here, economic stability, that's something that is oftentimes confused, but employment, income, expenses, debt, medical bills support. And very quickly, some of these can go high, and there's a lot of different things economic stability is made up. And then neighborhood and physical environment I look at as built environment and the social determinants of health. And this is looking at housing, transportation, safety, parks, and then playgrounds, walkability, and zip code geography. Education is something that is also in the other social determinants of health. So that includes literacy, language, early childhood education, local vocational training, and then higher education. And then food insecurity actually goes under economic stability, but in KFF they decide to make it a different domain because of such an important context. Next, we go into community and social context. This is support systems, community engagement, and everything else. So we've gone through community, community and social context, and of course that is social and community context is part of the original as well, the 5 domains, and then healthcare system. So access to health, insurance coverage, linguistic and culture, competency, and then quality of care. So that summarizes the different determinants of social health, social determinants of health, not only with the Kaiser Family Foundation, KFF, but also looking at social determinants of health, which is part of the Centers for Disease Control, and other types of other organizations that have come up with social determinants of health. Thank you for listening.